Happy New Year, everyone. I really wish I was there to co-host The Power of One. However, I'm an active duty Marine, and when duty calls, I must present. I want to thank you for watching and giving your valuable time to learning the important role of CASA, as well as the life-changing differences they make in foster youth's lives. I'm living proof. I really hope you enjoy season 2, and thank you for joining us on The Power of One.
We are back and here for part 2. We had so much information that we decided to turn this into a 2-part episode for us here today. And we are here with Ashley Kelly, our trauma therapist, Judge Pickard, who's our esteemed co-host today. And we're going to shift topics just a little bit. We're going to go into medication in foster kids and how that all works. So maybe you could just get us started.
My experience a lot of time, and this is where some of my stuff at like working at the hospitals has worked a little bit more, where I am seeing all these kids come in and immediately we're kind of like med wash, because these kids are on a lot of different meds and a lot of the time.
Med wash, what does that mean?
So that means we're kind of like, oh, let's take them off of everything safely. The psychiatrist does it very well. They do a good job and stuff, but just getting them into a space of like, oh, okay, we need to start over because we've got too many things counteracting, working with each other, and just they're too medicated and stuff.
So you basically you titrate them off of these medications, and then from there you assess what should we have them on to calm them, and maybe one's making them calm, one's making them upset, so they equalize and really don't do any good.
Yeah. So there's different things there. Sometimes too many meds can make more aggressive behaviors, or it might make them a little less aggressive, but now they're like lethargic and nothing's happening, different things that way, or their mood is hard to stabilize out and stuff. So you can see that a lot different times, or a lot of times too, it's not always that's what's happening, but sometimes if you're more like really aggressive kiddos that kind of get labeled that way, right, where they're just so aggressive and we don't even look into like, why are they aggressive, right? So sometimes the medication can make it worse when it's like there's too much going on there, but a lot of the times they're not on the right things, especially when you kind of look at there's a spectrum to treat here and stuff when you look at all these kiddos. And if you're dealing with trauma in general, which almost every kiddo in there is experiencing some form of trauma, and so some respond to it worse or not, right? But at the same time, you're looking at these kiddos are struggling, and now we're just going to put a medication here to do it, and we're not really treating the internal process of what's happening again, right? So we can't, medication, while it can definitely help, doesn't always treat and solve everything.
It's not always the go-to answer.
And just like our diet pills, right? They don't always work, and we're like, oh, I still have to exercise and eat, right? If I really want something to happen, right? So
as a CASA volunteer, I think this is the thing that I struggle with. I think I say this in every episode the most, right? Okay. But it's one of the things that's so difficult. So viewers may have seen this in the past. My co-host Emilio is a U.S. Marine. And when he was in junior high school age, right, teenager, the decision was made to put him on some pretty extreme medications. And his CASA volunteer got involved and said, whoa, let's hold for a beat, let's pause, because if he takes these medications, I happen to know there are certain career choices that he may be limited from based on what medications and diagnoses he's had.
Like military and law enforcement.
Absolutely, sure. And that's it. So he was going into the military, and she knew, thank gosh for that, right? Because I wouldn't have known something like that at the time. But how difficult is that, right? Those decision making to weigh out what the behaviors and the things the kids are experiencing with what their future potential is, and are we holding them back? Like talk to me a little bit about that.
Yeah, and I think that's probably one of the hardest spaces to work with too, because you've got all these like psychiatrists, and then you've got doctors and everyone, right? And like sometimes it's not even the psychiatrists that are wanting to treat the mental health all the time, right? So if I hear that immediately and I'm in that room or on that treatment team, I'm going to go, okay, is this like an MD doctor, just like straight from like family practice, like kind of thing? Like I went over there to my general doctor and now they're wanting these kind of meds in there? Or did a psychologist do a big evaluation to really get these like real diagnosis labels here and stuff of all the testing? Because these labels are so different. Not everyone knows the difference of them, right?
So before they're put on psychotropic medications, they should have some kind of an evaluation through a psychologist or a psychiatrist. Is there a preference?
So like my preference would be, this is where it can get very costly, because I would love a psychologist to see them first, because they're really going into the history and treatment of like your mental health. A psychiatrist, they're the ones who prescribe the medication. However, your visit still might only be 15-20 minutes with them to get that history, and they're listening for all your symptoms, all your different stuff. And while they're trained in the psychology side of it, everything, still not a lot of time, where a psychologist has probably spent at least 3 hours with you potentially, and like depending on the diagnosis, depending what they're testing for, but they're looking for a lot more. So they're getting a lot deeper history of what could be going on with this kiddo to give some of those things, and then starting there. So that's kind of one of my like starting points that I would say, like, okay, if we're really trying to advocate for this kid, that's not always the perfect world. I could also look at just kind of knowing what the medications are. Like you're saying, where you're like, a lot of times your social workers don't know this. The caseworkers, the foster, nobody, a lot of your psychologists people, we didn't go to school for medication. I learned most of my medication understanding here because I've been working next to a psychiatrist in a hospital, and we had to make decisions together based off the treatment, where I was the clinical director and she's the psychiatrist. So she's the treating doctor. I'm kind of the therapy doctor over here, right? Helping like make those decisions together. And so in that space where it's like, who's really educated in making these decisions, and do we understand what's happening and where it's starting? And then again, it's like, how long do they need these medications?
That was going to be my question.
And where's the treatment for it to have? Because like at some point, the medication is going to stop working. Your body chemistry is going to get used to it, and you're always going to have to up it. We're basically saying you'll be dependent on this if that's the only consistent thing that's happening, which unfortunately sometimes that might be the case for some of these kiddos who, like the last episode when we talked about the kid who moved around 17 different homes, right? Where it's like, that might be easier than getting them into a consistent therapist. And so we have to look at it. However, how do we get a consistent continuum of care that's hitting all the spaces, so that medication isn't necessarily the only consistent treatment?
You're saying that Clark County Family Services probably needs to have an in-house psychiatrist that is looking at the medications when there's a problem. So if a kiddo has a lot of multiple outbursts or other behavioral issues, maybe just have that in-house say, let's take a look at the medications, let's send them out. Or because I'm thinking it takes months.
Right.
It takes months to get a psychologist. It takes another couple of months to go to the psychiatrist. So here we are 6 months later.
Mm-hmm.
So I'm wondering, what are some...
Well, I'll add another layer to the challenge, right? In that oftentimes in my experience, the foster parents are the ones who go through that evaluation process with the kid, right? And they go through the assessment. They may not have been with that child long enough. So like in my case, if a child's been in that many homes, she's known me far longer than she's known the parent. However, I'm not in any place to be able to do that because they don't live with me. Right. So as much as I spend more time with the child, I don't see them, right? Like sometimes the questions are, how do they get up in the morning or go to bed at night, or do they brush their teeth, right? Things like that. Well, I don't experience those things, right? And so that's one of the challenges is who's presenting that information to make such a critical, important decision.
Absolutely.
Does every kid need medication that goes through trauma?
Does every kid need medication? No, for sure not, and stuff. Is it sometimes necessary? Yes, for sure, and everything that way, where it's like, it definitely can be, especially when you're seeing so many behaviors, though, oftentimes today's world is kind of like, oh, let's get on medication because these behaviors are so extreme, right? And stuff, and that can be said about many different things beyond just behavior, right? However, in that case, you want to start looking at, okay, well, yes, this is one way to work it. However, it's kind of assessing and getting the teams in that habit, if we're really thinking like more trauma informed and being aware, where it's like, well, what have we tried to work with for these behaviors really and stuff, and how consistent has it been? Because when you talk about a history of trauma and all these things happening, that doesn't heal in 3 months. That doesn't heal in a year sometimes and stuff, when you talk about that, and where it's like, where is that happening? However, back to your like DC, just to make sure, because I don't want Clark County to feel like, oh, targeted on them and stuff. Like, I do think they have, like, I don't know their whole system. I'd have to look.
My kids all go through MedMan.
Yeah, because that's what I was like, I know they work with, and like I've had at the hospital, I've had some be like, when we've asked like, oh, can we use, like, they are particular, at least here in Las Vegas, which I've noticed and stuff, they do ask those questions. And then they do have some who are trained in med management and like at least listening and hearing for it. The problem is with like many things and stuff, like are there enough like professionals to do that? And that's always the thing, like there's not enough of us.
Well, and how do you get the kids to engage in answering the questions? How do you get the foster parents to engage, right? I mean, those are some of the challenges. Like we've all worked with teenagers, right?
Right, absolutely.
Raised them, worked with them, whatever our experience levels are. And they can be difficult, right? Try to get a teenager to respond to, how are you feeling today? Or what's going on in your life today in any situation. And then you add these layers of complexity that our kids that, are in care are experiencing. And they don't want to be on medication, right? They're looking at it saying, I don't want to take this anymore.
And especially the day of the evaluation sometimes, right? Like I've seen it in hospitals all the time where it's like, oh, like you have to do it. And they woke up, they had the worst day, they got in a fight with some peer, and now they have to go to this evaluation. And so now they sit in the evaluation and they just ice you out kind of thing, right? And nobody lets the evaluator know. So they're like, oh, flat affect. And like going through all these things and labeling them with like a whole different perspective versus like, oh, what was like, hey, they're actually not in their best state right now, right? Like maybe we do need to reschedule this even though it's inconvenient.
That, it makes me think of a story that I had heard. Emilio actually shared with me at one point, and shared with me, he said, sometimes being in foster care makes me feel like, imagine you're in the doctor's office, and the doctor's office, just assume you're in there, a parent and a child, right, or in the doctor's office, and the doctor takes the little thingy to test your reflexes and hits your knee and says to the parent, do you think that hurt? Do you think he felt that? Versus just talking to him and saying, did you feel that? What did it feel like? Right? He said, sometimes I felt invisible and people were asking questions around me where my head was just screaming like, ask me, I'm the one. Right? And I'm not saying that therapists or med management or psychologists aren't asking the right questions, but the kid's perception is no one listens to me. So I'm just going to sit back. Why should I even answer these questions?
And sometimes I think it is just one of those things where it happens, unfortunately, as professionals, right? Where it's like you have a job to do and you think about some of these people, they have 15, 20 cases of kids that they're like working with. So it just becomes one of those. And unfortunately, it's like we do our best, right? However, it can become that, oh, I have forgotten this kid is right here in front of me versus let me talk to this team versus let me talk to this kid and let them weigh in on that and stuff.
Right.
What do you think about, and I don't want to get too off topic, but kiddos who are having a lot of difficulties in care coming to the court and talking to the court, like being present at a court hearing. So CASA Volunteers brings a child into a hearing because all the professionals are saying, wow, we've got him on medication or got her in this therapy. And maybe for the child to speak for themselves. Right. What do you think? Is that trauma, create additional trauma or relief?
Every kid is different. Like every kid that I've worked with and stuff, some really want to be the ones to advocate for themselves, and then they get up in front of it. And I've seen it just on like Zoom court I've attended with them, and then they see the judge and it's just on video and they're like, and then they're like looking at you to the side, right, and everything. So it's like providing them the options and stuff where it's like, have them write it down, have them write you a letter, have them maybe create their own little video in case they freeze up. But then some really do well and they do want to communicate it. So that's incredible and stuff where it's like when they can do that, I'm always like, I just want to give them every opportunity to do it. So I kind of, especially if I know they might be a little bit shyer or they might get nervous or they express being anxious, I ask them, do you want to make a video with me or a letter and whatever their thing is? So then at least there is something that their own words get handed into, like the judge, especially.
And the CASA volunteer.
To me, that's it. It bring it back to that power of one, right? Whoever that one is, just make sure that there's somebody who's guiding that child and helping them to understand what their options are. And so for me, and I'd be speaking to all my other CASA volunteers out there, for me, what I always do is I encourage my kids to be as involved as they can be, age appropriate, right? So to me, what I've always heard is 12 and under, little more cautious in that. Over that, they probably belong in there, right? And so I just try to tell my kids, you don't need me to advocate for you. You're going to need to advocate for yourself in life. And so how do we help you, right? And so that first court visit might be just sit next to me and listen and just be present and hear what's going on in your surroundings and what's happening within that situation. And if you're not comfortable, that's okay, right? Or the judge might ask you a question and you should answer if you're comfortable, right? But letting them kind of take it slowly and see that. I love the recording or writing a story. I think that's a brilliant idea.
That's very interesting. And writing it down on paper, right? So they can just come in and they can kind of read it to everybody. So I think that would be important too for kids to have a voice. I always say to kids, you have a voice but not a choice, but your voice is just yelling at me.
You have a voice but not a choice.
It's so important that I hear from you. I love to hear from the kids.
Ladies, this has been phenomenal as always. I'm sure we'll have you back. I know we'll have you back for sure. This has been absolutely amazing conversation though. Hopefully it's beneficial to all of our viewers out there. We're really excited to have you take part. Again, Power of One podcast. Super excited to have you here, and take care.
Bye, everybody.
A future starts again, one